These are, wait, nope. These are dental implants, and today I'm going to tell you everything you need to know about them and why they may be your best option to replace a tooth or teeth. All right, guys, so today's video we're going to talk about dental implants, and what a dental implant is in layman's term is basically it's a titanium post that is analogous to a tooth root, so it's the same thing as a root that helps to anchor a tooth or teeth in depending on how many teeth you're replacing. So how do they work? So there's a step-by-step process. So typically what happens is when we go to place a dental implant, we drill a hole, we screw a screw into it, and that's that titanium post. They make them in different sizes, shapes, colors. No, maybe not colors, but they make them in different sizes and shapes so that when we place this thing in the jawbone, it is appropriate for the particular area. Some areas where we have a little bit more length, we can put longer implants in. They have thinner ones, they have fatter ones for, kind of like the molar region where there's a little bit wider bone. But basically, we're putting a titanium screw into the jawbone and it's going through this process of osseointegration, which is a fancy term that just means that it fuses to the jawbone over a period of time. So that usually period of time is anywhere from 3 to 6 months. The time can vary a little bit. Typically, if it's native bone, meaning that there was no tooth there before and there was no grafting done, that time period is more toward the 3-month time period. Sometimes if someone has had a bone graft, which sometimes take a little bit longer to heal, or if they've lost some bone and they have to have some bone graft along with the implant, sometimes that can take upwards of 4 to 6 months, okay? Why are implants better than dentures or bridges? Well, dentures are from like George Washington, right? So that technology is from a couple hundred years ago, and bridges are maybe from like Abe Lincoln's time, right? Well, maybe I'm exaggerating a little bit, but anyway, you guys get the point. So that stuff is older technology. Implants were kind of discovered really in the 1900s, and they've really come a long way since then. And typically when a tooth is lost, the tooth, unless it's replaced with an implant, the bone is going to atrophy. It's going to go away. It kind of dissolves over the course of time. And what happens is if we place a dental implant in that area, that helps the body to sense that there's something there, and it keeps the bone in that area, versus if you have a denture or a bridge, then that bone continues to atrophy and go away over the course of time. Dental bridges, if you are missing a tooth or you have to lose a tooth, say in a certain area, how a dental bridge works is you have to shave down the adjacent teeth, right? So you guys know, maybe you've heard of like a dental crown. So a bridge is there's 2 crowns on either side of the space, and in the middle is the missing tooth. That's where the area where we would call the pontic, or the part of the bridge that is replacing the tooth. But what happens is you need anchor on either side, and you have to shave down the teeth. So if you put a dental implant, you don't have to shave down anything typically, right? You're just kind of putting the implant, you're fixing the area, which is actually the affected area, and you're being more conservative and you're not adjusting or doing any adjustments to the teeth, right? Okay, let's talk about who's a good candidate. So typically you have to have bone in the area. So people with healthy gums, healthy bone structure, typically are the best. Sometimes when we do certain larger procedures where we're putting multiple implants, we need to kind of prepare the area. So if there's any infections or anything like that, we need to go in and kind of clean everything up. And sometimes we'll do some bone grafting. We need to make sure we have really good healthy bone. Smoking, it's one of those things where it's definitely not contraindicated, but the complications that I've seen when we do this procedure is typically people that smoke. So I'm talking about smoking, I'm talking about vaping, I'm talking about smoking weed, smoking cigars. Anything that's like smoking and inhaling smoke into your mouth is not good. All right, so what's the process like? So the process is there's typically an initial consultation. Like I said, if someone is having a tooth that needs to be extracted, sometimes we'll have to kind of prepare the area where we'll take the tooth out, we'll do some bone grafting, we'll wait a period of time, 4 to 6 months, and then we'll go back in. Or sometimes we can do it in conjunction with the implant placement. It kind of depends. It's a case-by-case, on a case-by-case basis. But if someone is coming in, they've not had a tooth there for a little while and the bone is good, and everything is kind of healed, then typically the process will be having the initial consultation, taking either an x-ray or a CAT scan or a combination of those things, and then kind of pre-planning for the area. Now, in some cases, we're able to do it what we would say freehand. So we'll just go in and the dentist just uses a drill to drill that initial hole, the osteotomy, where the implant's going to go, and then screws the screw into it. Sometimes if the bone is very, very thin, or there's some sort of an anatomical structure like a sinus, or on the bottom there's a nerve, or just really the bone is very, very thin and we only have maybe a millimeter of leeway on either side of the implant, we can make what's called a surgical guide, which basically will digitally kind of do the surgery, place the implant virtually in the bone, in the CAT scan, and the x-ray, and then we'll get a plan from that, and then the lab will send us a kind of like a night guard. It's a piece of plastic with a hole in it where the implant's supposed to go, and then we go through a sequence of drills where we place the appropriate size hole, and then we put the implant into that. Okay, that's typically what it is. So initial consult, imaging, we'll do the surgery. There's typically, like I said, a healing period. If there's no grafting involved, typically it's about 3 months. If there is bone grafting, it's 3 to 6 months or 4 to 6 months, and then the final prosthetic goes on top of that, which sometimes for a single tooth may take a couple weeks, 3 to 4 weeks, or if it's something where we're doing full arch implants, it may take a couple months, but kind of depending on the case, that's the typical time frames. Cost and insurance. So this is an investment, right? This is not a quick fix. And this is something that I try to emphasize with people. If it's my mouth, I want the best treatment. And some people look at this as a cost, i.e. I have to pay $5,000 or $6,000 for this thing, but I'm going to opt for the bridge, which is only a couple $1,000s. But listen, down the road, that bridge, more likely than not, is going to have to be replaced at some point. And then even just redoing it one time, you've already paid as much, if not more, than the cost of a dental implant, and you had to shave down the teeth, and you have bone loss, and you have to go back to the dentist, and you have to get multiple procedures done. Implants are more of an upfront investment, so it may be more costly in the short term, but in the long run, these things typically last longer. They're a lot less aggravation in time, and who likes going to the dentist? The answer is nobody. So if you can reduce the amount of times that you go to the dentist, that's a win-win for everybody, right? That's basically it. Life after implants, you're gonna take care of these things just like you take care of normal teeth. You brush them, you love them, you floss them. If it's a case where there's all in X or all in 4 or teeth in a day type of situations, sometimes you can't floss with the teeth because they're all attached together. So what you would do is basically you would use something like a water pick or something like that. All right, guys, thanks.